Are there alternatives to paracentesis? If you are curious about alternatives to paracentesis, you are not alone. Paracentesis is a procedure that removes excess fluid from the abdomen, often used for conditions like liver disease. However, there are other options available depending on your situation. One common alternative is medical management with diuretics. These medications, often called water pills, help the body get rid of extra fluid through urine. This can be especially helpful for those dealing with fluid buildup due to liver issues or sensitive digestive conditions like irritable bowel syndrome and colitis. Dietary and lifestyle changes can also play a significant role. Reducing salt intake to around 1,500 milligrams per day can help manage fluid retention. In some cases, doctors may suggest limiting fluid intake to prevent further buildup. Avoiding alcohol and certain medications that can worsen liver or digestive health is also advised. Another option is the Transjugular Intrahepatic Portosystemic Shunt procedure. This minimally invasive procedure creates a channel within the liver, helping to lower high blood pressure in the portal vein system. This can reduce the chances of fluid buildup and improve kidney function. However, this option is typically reserved for specific patients and comes with its own risks, such as changes in brain function. Sometimes, doctors may choose to monitor the situation without immediate intervention. If the fluid is not causing significant symptoms and there is no infection, careful observation can be a safe approach. This avoids the risks associated with procedures while ensuring that the patient is closely watched. Supportive treatments may also be necessary, especially if infections are present. Antibiotics can help treat infections related to fluid buildup. Additionally, vaccinations for influenza, hepatitis, and pneumonia can help prevent complications in patients with liver or digestive diseases. For those with sensitive stomachs, it is essential to work closely with healthcare providers to determine the safest approach. While paracentesis is generally safe, it involves inserting a needle into the abdomen, which can cause discomfort or rare complications like bleeding or infection. Therefore, alternatives like diuretics and lifestyle changes may be preferred initially to minimize invasive procedures. In summary, alternatives to paracentesis include medical therapies such as diuretics, dietary adjustments, the transjugular intrahepatic portosystemic shunt procedure in selected cases, and careful monitoring. The choice of treatment will depend on the severity of fluid buildup, underlying health conditions, and individual patient factors related to digestive sensitivity.